Hello and namaste. A couple of days back, I got a query from one of you asking for what is the difference between a chiropractor and a physiotherapist and a Egoscue specialist. So today I will tell you the differences and when should we use a chiropractor, for example, and when should we use a physiotherapist and an Egoscue specialist. My name is Prashant. I am 50 years old. I was paralyzed at the age of 32 due to ankylosing spondylitis, but now I am a marathon runner. I'm also a certified Egoscue specialist. I'm a pranic healer and a mindset coach. Now let's get deeper into what are each of these modalities: chiropractor and physiotherapist, as well as Egoscue specialist. What do they do? Now, chiropractors are basically people who work on your spine. So they will be focused only on your spine. Okay, they work on any misalignments which happen in your spine, and they don't work on any other joints. Okay, so they will work on your spine and they will try to adjust that manually whenever you have any sort of misalignment. So if any of your vertebrae get misaligned, they will do a manual adjustment. That is usually done by twisting your body or pushing certain parts of your body so that the spine gets aligned again. And this is also helps in your in the untangling your nerves. So if you see these nerves here, it helps in relaxing those nerves, and it is used in when normal people develop back pain, neck pain, or let's say a hip pain or lower back pain. So in these sort of circumstances, you use a chiropractor. Okay, who is a physiotherapist? Now, physiotherapist is a person who will help you to become more mobile, more agile after an illness or an accident, or let's say a prolonged illness. Okay, so physiotherapist helps you to develop a rehabilitation program, and that rehabilitation program will have musculoskeletal stretches, it will have exercises, it can have certain machines. So it is used when people are recovering from certain accidents, certain sports injuries. They have injured their knee. You would have seen cricketers, they injure their elbow or their hands or sometimes their knee. So post-operative care is usually all for sports people, also comprises of physiotherapy. So there is a rehab program in which you also, apart from doing stretches, you also do certain weight training. So that is physiotherapy. Okay, now Egoscue specialists are those people who deal in misalignments in your entire body. Okay, they look at body as a unit and they look at all the joints in the unit, especially your loading joints, which is your two shoulders, two hips, two knees, and two ankles. So in the entire body, they don't restrict just to the spine. So spine is very important, but they will also look at your knees, your hips, your shoulders, and try to remove any dysfunction, any misalignments which are there through easy exercises. That is what an Egoscue specialist does. So Egoscue specialist will normally call you for a consultation, and in that they will full 360-degree analysis of your posture, and they will remove any postural deviations or dysfunctions in your body by doing certain small or easy exercises in your pain-free range of motion. Now, these exercises are full body exercises. They can be done standing, sitting, or sleeping. Okay, and depending upon how the patient feels. अगर patient खड़े होना चाहते हैं तो they will use standing. If the patient can sit, then we'll do a sitting exercise, and if the patient is easier to lie down, then they will do sleeping position exercises. Okay, so based on how mobile is a person, we give easy exercises. We remove any rotational dysfunctions or any sort of misalignments in your joint. We bring it back to normalcy, and that reduces the pain in the long run. So if you want to quickly summarize this, then Egoscue is used for postural misalignments, and it is done in a pain-free range of motion. It is done to reduce your pain. Physiotherapy is done when you have sports injury or when you are recovering from an illness, okay, or from an accident. It's a rehabilitation program in which you try to bring back mobility into your joints, and that also reduces your pain. Okay, third is chiropractors. They focus only on the spine. Okay, so they focus only on the spine and nerves related to the spine. and they do manual adjustments. Okay, they have certain tools also in which they try to remove the misalignments in your joints. So these are the three modalities. I hope it's clear in this video, and if you have any other question, I would encourage you to ask these questions. I'll try to answer them in my next video.